Hello everyone, this is Shabnam here. Welcome back to my channel, The Counseling Corner. A gentle reminder, in case you have not subscribed to my channel, please do so and hit the bell icon so that you get timely notifications whenever I post my new video. So in today's video, I'm going to speak about the sleeping disorder. Let me ask you a few questions. Are you a person who is finding it difficult to fall asleep and stay asleep throughout night? Are you a person who gets good sleep throughout night but finding it very difficult to focus and concentrate and finding it very sleepy during the daytime? Or are you falling asleep during the important meetings and seminars and then feeling embarrassed about it? If yes, there is a chance that you are suffering from some form of sleep disorder. So in today's video, I'm going to speak about the 7 different types of sleep disorder, the causes and the treatment. So the first type is known as insomnia. So here the person finds it very difficult to fall asleep and to stay asleep throughout night and feels very drowsy. Here the major contributing factor is known to be the stress, when a person is overthinking and worrying about something. And other factors include some side effects of medications or some medical illness like asthma, chronic pain or arthritis, as well as poor sleep hygiene. See, if these symptoms are there for quite some time, then maybe 3 months, or if it continues more than 3 months, then it can become chronic and lead to severe physical and mental health conditions. And the treatment which is given here is cognitive behavior therapy, as well as medications might be prescribed. The second type is known as the snoring or sleep apnea. See, snoring can be very irritating. At the same time, it could be very dangerous if avoided. In this, the person would be experiencing a choking sensation while sleeping, as well as there would be interruptions in breathing at nearly 5 times in an hour. Breathing starts, stops, again it starts. So this will have an impact on the flow of air, and this will in turn affect the quality of the sleep. And if this is avoided, it might lead to severe complications like stroke, high blood pressure and cardiovascular disease. Here the treatment includes a therapy which is known as CPAP, which stands for Continuous Positive Airway Pressure Therapy. And this will ensure the continuous flow of the air into the airways. But in severe cases, the person will have to undergo surgery, as one of my friends recently underwent a surgery last month and she's fine now. So the third one is known as the parasomnias. So in this disorder, the person would be experiencing uncontrolled sleep episodes like walking in the sleep, sleep talking, eating due to sleep disorder, hallucinations, nightmares, as well as sleep paralysis. So in the morning, if you see, the person will not remember anything. So some of the parasomnias, like if you take nightmares, this could be contributed due to post-traumatic stress syndrome or due to prolonged sleep deprivation. So the fourth one is known as the movement disorder. Example, restless leg syndrome. I have also experienced this. In this, what happens, there is a strong urge to move your leg while you're sleeping, because you will be getting an uncomfortable sensation in your legs and your feet, and this will be relieved only when you move your legs. And the contributing factor would be some side effects of the medications which you're taking, or some illness like kidney disease, or it could be due to neuropathy, iron deficiency, like anxiety disorder, or if you're consuming some antidepressants. And the treatment would be, doctor would be prescribing some medication to relieve the pain. So the fifth one is known as the circadian rhythm disorder or sleep-wake disorder. See, our body has an internal clock which guides us when to sleep and when to wake up. And when this gets disrupted, a person will find it very difficult to fall asleep as well as to wake up at the desired time. And this can be altered by following a proper sleep hygiene as well as lifestyle modifications. So the sixth type of disorder is known as the narcolepsy. Here the person will feel very drowsy and sleepy during the daytime. They will find it very difficult to remain awake for longer period of time, and sometimes there would be sudden attacks of sleep. And this will in turn have a negative impact on the day-to-day functions. And the contributing factor is the lack of a chemical secreted by the brain which is known as the hypocretin, which regulates the sleep. The seventh type is known as the hypersomnia. that is excessive daytime sleepiness. Here the person will find very drowsy and sleepy during the daytime, even if he had slept for 7 to 9 hours during the night. There are people who have slept for 12 hours during the night, but even then, having an urge to take a nap during the daytime. And the causative factors would be the neurological factors as well as some medical conditions like sleep apnea. And the treatment for this is some drugs would be prescribed by the doctors. To you, please to share and subscribe to my channel, The Counseling Corner. And most importantly, hit the bell icon so that you'll get timely notifications when I post my new videos. So see you next time.